This program is brought to you by Presto Personalized Wonders.
Mayam Bukrumzari dom na English Impact News ni ay Joyshree Usham na Impact News ki Impact Health Link for a Healthy Manipur program asida taram nokchari ngasi akhoi na pujaragli ba topic asi arthritis and treatment options haibadi saru sarang na anaba arthritis hariba laina amadi masigi lying pathap ki matang dani hiram asida ko warol thambina ba ngasi akhoi studio da lengchin biriba expert na Dr. CHETAN KABRA MBBS MS in orthopedic MCH Ortho UK spine and joint replacement surgeon Apollo Hospitals, Guwahati dagi. First of all, thank you so much for taking your time to be with us here today.
Thank you so much for inviting me today.
Okay. Doctor, as an orthopedic, we would like to know what is the most common complaint that people come to you with?
Well, the most common complaint that the patient comes to us in the OPD is basically joint pain. So like joint pain can be because of various reasons, but the most common being the arthritis. Now if I have to explain in a simple term, joint pain is basically when when any joint of our body can be involved.
So any joint, it can be knee, fingers, any part of the body.
Spine also, spine has got multiple joints, and the most common being the spine and the knee pain, which the patient comes to us with.
So as you said, arthritis is the most common one. So what is arthritis and what are the different types of arthritis?
Yeah, that's a very good question actually. See, when we say like joint pain, we actually normally first decide whether the patient is suffering from arthritis or not. So there are various forms of arthritis, and arthritis is basically joint pain and the various forms are like the osteoarthritis, which is the most commonly seen in the older age group. Age is the main factor here. Then there is a rheumatoid arthritis, where most commonly seen in the comparatively younger females, where multiple joint pain is involved, mostly the small joints, especially this joint.
The fingers.
Is involved. Yeah, the fingers. Generally, when one side of the hand is involved, the other side is also involved. The patient normally complains of pain with morning stiffness. So that's the rheumatoid arthritis. Then there is a gouty arthritis. There is a post-traumatic, any fracture, joint below and a joint above is more prone for arthritis. So and if the fracture of the joint is there, definitely the patient is prone for a post-traumatic osteoarthritis. Then there is a septic arthritis, which can happen because of infection. Any infection in the joint can lead to septic arthritis. But of all, the most common is the osteoarthritis, which almost all of us at some point of time in our life may suffer.
So like how common is arthritis in the country?
When it comes to osteoarthritis, I'll rather talk more about osteoarthritis today, because rheumatoid is a fixed disease, which is like very selected group of patients will be involved. Osteoarthritis, if you talk about percentage wise, then every second female above the age of 50 years will suffer from osteoarthritis definitely at some point of time after the age of 50 years, and every third male, which means 33.3% of the population above the age of 50 years, male population, will suffer from osteoarthritis, be it osteoarthritis of the knee joint, osteoarthritis of the spine, osteoarthritis of the hand, osteoarthritis of the foot. Some form of osteoarthritis definitely they will suffer from.
So why is it that the female population suffer more?
It has something to do with the estrogen. After the age of 50 years, post menopause, estrogen is actually very protective. It protects our joint. So when estrogen disappears from the body after menopause, the female patients, they suffer more from osteoarthritis than males. Exact cause nobody knows, but they are more prone for osteoarthritis.
So as you said, like 50 years and above and after menopause, mostly this disease affect. So is arthritis found only in the older population, or even younger people also suffer from
this? Well, when it comes to osteoarthritis, it's mostly the older population which is involved. It's like, if I have to explain in a simple term what is the definition of osteoarthritis, it's a wear and tear of the joint. So you buy a new car, you use it for few days, few months, few years, and gradually there is a wear and tear of the car occurs. The tires, they get worn out. Similarly, like the joints, because like every time you are walking, the joint is moving. So some damage is happening. This micro damage which happens over a period of time will lead to osteoarthritis.
And like as you said, like every 1 out of 2 female will be suffering after the age of 50. So women, because of fashion, we tend to wear high heels. So will this also be a contributing factor?
Yeah, definitely everything will contribute. Every movement of ours, every activity which we perform has got something to do with osteoarthritis. So if you wear a high heel sandals, definitely it causes more pressure over the knee, more pressure over the spine, more pressure over the foot also. So obviously, like you will be more prone for osteoarthritis. Weight itself is an important contributing factor. Indians in general, we are becoming more obese now. So when you say the height is 5 feet 2 inches, the weight should be of a female around 52 kgs. Now imagine if the female's height is say around 65-70 kgs, the extra weight which the knee joint has to bear, which is above 50 years old, which is already like very old, how will they bear? So definitely it will lead to pain and like inflammation and other factors.
And doctor, as we talk now, even my left knee is like slightly paining, and I thought it is because of the weather and gloomy weather and things like that. So what are the symptoms of joint pain and arthritis? Are all the joint pains arthritis?
No, not really. If I talk about osteoarthritis, which is the most common types, there are mostly 3 common symptoms which the patient complains of. One is whenever they get up from the chair or they get up from the toilet. When they get up from the temple, they are praying, and then suddenly when they get up, they feel this pain around the knee.
Okay.
Then there is a clicking sound coming from the knee joint. Climbing stairs is painful. So these 3 symptoms, invariably the patient generally complains for osteoarthritis of the knee joint. So with the back also, like there is a pain, there is a nagging pain troubling them all the time. Especially in the morning when they get up, they feel this pain more. So osteoarthritis of the knee is the most common. Hence, I am talking more about knee pain here. So knee pain, when the patient gets up from the floor, they feel the pain, clicking sound coming from the knee joint, climbing stairs is painful. These 3 symptoms, we are quite certain this patient is suffering from osteoarthritis. The pain is more on the inner side of the knee.
Inner side of the knee.
Yes.
So for rheumatoid arthritis, it has to be on both sides of the body.
Inner rheumatoid arthritis is totally different. Like for example, you told about gloomy weather.
Yeah.
Winters,
so that's rheumatoid.
rainy season. So all these things will actually increase pain in rheumatoid arthritis patients. In rheumatoid arthritis, it's normally mostly small joints are involved.
Okay.
So as I said, like hands, like the joints are very small. So whenever these joints are involved in one hand, generally the patient will have pain in the other hand also. So bilateral symmetrical joint pain, bilateral symmetrical joint pain. So multiple joint pain, mostly of both the hands, with morning stiffness where the patient is unable to make the knee straight for almost like 30 minutes at least. It takes a lot of time. Yeah, minimum 30 minutes. It takes a lot of time for them to make the fingers straight. There's a lot of swelling in the fingers. So that's when we make the diagnosis of rheumatoid. There are certain criteria actually. These 3 are the most common when we make the criteria with the definition of rheumatoid arthritis.
So like is osteoarthritis treatable or reversible, treatable? Please,
well, I normally tell my patients, I give the example of grey hair.
So grey hair,
Almost
we can always apply dye and make it black.
Everyone in this world will have some amount of grey hair at some point of time in their life.
Yeah.
Everyone will have some form of osteoarthritis at some point of time in their life. As the age progresses, the hair will become more and more grey. The osteoarthritis will keep on increasing. You after a certain age you have to wear glasses.
Yes.
You cannot see near things properly. Your tooth starts to become loose. You have this wrinkles. So all these things are aging process. So osteoarthritis to an extent is like related to your normal aging process. It is not reversible. The damage is permanent. It will keep on increasing. We can reduce the symptoms by doing certain exercises. We can reduce the symptoms by certain form of medicines. We can reduce the symptoms by reducing our weight. The most interesting thing is, if you can reduce your weight by 10%, your knee pain will come down by almost 50%.
Okay. So is there any specific diet apart from exercise? Like how do we maintain a healthy lifestyle so that we can prevent the onset of this disease?
See, the problem with us is, we normally tell our children that I will not give you breakfast if you don't take bath. But we never tell our children, I will not give you breakfast if you don't exercise for 1 hour. Now what is more important? See, we have to inculcate in our children right from the beginning that exercise is an important part of our lifestyle. So when you say healthy lifestyle is waking up early in the morning, doing exercise for an hour, eating just to make our stomach full, eating not to not for our tongue but for our body. So if you want to have mithai, like mithai, the nutritional value is 0. If you have sweets, the nutritional value is almost 0. You cut down on your sweets, you walk more, you do morning walk for 1 hour. It does immense good to our body in general. So healthy lifestyle basically is sleeping for 7 hours to 8 hours a day every day, waking up early in the morning, having very healthy diet.
So when it comes to diet, what about smoking and drinking alcohol?
No. Obviously, like alcohol, smoking, all these are contributing factors in increasing the osteoarthritis, because smoking reduces the blood supply to our joints, to our body in general, and it causes a lot of harm to almost every organ of our body and not just the lungs, by causing your atherosclerosis and other diseases, arthritis and all. It causes a lot of damage. Similarly, alcohol also, like in moderate consumption is okay, but if you are a heavy drinker, definitely you will cause more osteoarthritis to yourself.
But despite all these precautions, we will be suffering at one point or the other in our life.
Another important factor called genetic factor. If your mother or father or your other family members are suffering from osteoarthritis, chances of you suffering from osteoarthritis is definitely higher. These are irreversible factors. You cannot change it. There are various factors, right, which will cause osteoarthritis. So one of the factor is your genetic factor, which is beyond your control. You are obese, it is under your control. You can reduce the weight. Healthy lifestyle, you can definitely control. Exercise, you can definitely do. You had an accident, irreversible damage. You cannot do anything. You had an accident. Like nobody will cause an accident himself. Like, it does happen. So fracture, more pressure over the joint, you can't do anything. It's an irreversible thing.
So doctor, there are controllable things and uncontrollable things like the genetic factor. So is there any pre-test or any medical test that we can do advance in life so that we can prevent the onset? Or
no, certain things are beyond our control. It's like wrinkles on our face. Like
for example, in cancer, we can detect earlier.
No, but this is a normal aging process. This is a normal wear and tear of the joint.
So this is
you're walking, every time you're walking you're causing damage, right? Like for example, athletes who runs a lot, even they are more prone for osteoarthritis. Footballers, they're more prone for osteoarthritis because they've been using the joint left, right and center, so they're more prone for osteoarthritis, especially of the knee joint. So certain activities will definitely cause more damage to the joint than other activities.
So elderly population and female population and sports person, they are more tend to suffer from osteoarthritis. Now doctor, you said you want to focus
high impact sports here, high impact sports.
Okay. So you want to focus more on osteoarthritis, but I would like to know more about this one, rheumatoid arthritis as well, because young people also suffer from that. So if what kind of symptoms a young person should look out for?
As I told, in the younger population, multiple joint pain, especially of the hand and feet, more than 3 joint involvement, with morning stiffness of more than 30 minutes, definitely you are probably suffering from rheumatoid arthritis or some form of rheumatoid arthritis. If there is a strong family history of your mother having a rheumatoid arthritis, chances of you suffering from it is even higher. And for rheumatoid arthritis, you have to visit the doctor immediately.
So is it treatable?
Definitely,
unlike OA,
definitely,
OA is due to old age, wear and tear.
I won't say treatable, but definitely you can bring the symptoms under control. You can reduce the damage which is happening to the joint if you start the treatment on time. You should not delay it.
Okay.
And rheumatoid arthritis can be very, very, it causes a lot of damage, especially in the younger population. There can be deformity of the hand, deformity of the knee joint. So this has to be treated as soon as you diagnose it.
So how common is rheumatoid arthritis compared to OA?
Not that common, very rare, more common in females. Most commonly in females. Males hardly suffer from rheumatoid arthritis. It's mostly females who suffer from osteoarthritis. It is again genetically linked.
Is it linked to specific food items also? Not
really. Like once you suffer from it, then you have to find out what are the things which are actually aggravating your pain.
Is it true that fish, certain types of fish and meat?
You have to find out. It varies from individual to individual. Nobody can tell exactly this is the cause of my arthritis.
Okay.
You have to find out what is causing the pain. Like for example, rainy season, winters. Like you know that
yes.
Rainy season, winters like more painful. So you have to find out if any particular thing is causing the pain or aggravating or triggering this pain.
So it varies from individual to individual.
Yes, and you have to visit the doctor, you have to visit the orthopedic surgeon or a rheumatologist and start the treatment as soon as possible. The results are very good if you start the treatment early.
On time, okay. Yeah. Thank you so much, doctor. We'll take a short break, and after the break we'll discuss about the treatment options. Doctor Nangasi, Aquida Sarusang Naba, arthritis, Haribalina, Sigi Matanga, Takpitambiri, arthritis ki Makal Mayam lay and Doctor Napanbiring a Simaru and rheumatoid arthritis ki Matanga Zuka Tambire, Aduga, the osteoarthritis, Chahi, Yankai Matakta Leba, Aduga, every Mue Hongi Manunda, Nupagida, Hongi Manunda Miamadi, OAs in Nagali, Habagi, Doctor Giside Tambiri, Duga Nupi population, Dana, Nupi, Anigi Manunda, Amadi, Aduga Chahi, Yankai Matawera, menopause ki Matunda, OA osteoarthritis nabagi chance yamna wang hena doctor thambiri aduna doctor na maru na panbibase akogi lifestyle akogi weight se yamni hendaba weight se proper weight maintain tawba lifestyle ayung nganta hogatpa exercise pung amagumba chatpa adagi chaba thakpada yam section ba lay tongi laygi ahawba khatang thidabida hakchang da kanagadaba chinjak oina chaba aduga phattaba chinjak haibadi yu kumba chur kumba zara kumba chaba je si lepa si mayam sina akhogi OA je yamna di naganba wear and tear chahi yamakpagi matungina adum Naragadaba Dukuma Laina, Mazu Oiri Haibanina, Hogi lifestyle changes me and proper Taragadi, Masiki Laina, Yam Satiba Monga Chanchandring, and the Hona do Taptan Mangamani Habagi, Tazabazi, Dr. Gisati, Tambiria, Dumatanga Shwada Timber commercial brand, Telogagi, break Matunda, Nasigi, Impeg Helingi, Topicasi Makatana Kanazagi.
Lingsin Biraksi, First Cry Intellidots Preschool Ki Manipur da Ahanba Center Oina, Sagolban Moirang Layak Parking the Hangjari, First Cry Ki Education Experts Singna Same Lava, award winning curriculum ni. Preschool Asida, Chahi Amamakai Hauraga, Daycare, Toddler, Nursery, Pre-Primary 1, Amasung, Pre-Primary 2, Class Hangjagani.
Unique Net Academy admission opened Laliba March Kulhumdoidagi NEET UG 2023 class close Nungtilgi Pung Anidagi Taruk Fauba Hobjiragani class Amada Supnatagi Satra Kuntraga Nitoi Katamak Fundana up to date study materials doubt clearing classes Amadi Sunday test Tamdana Satra Singbook NEET exam Didamak prepare Tabjudiba institution ni NEET 2022 da 450 plus 40 plus Amadi 350 plus Pangaklaba General OBC Scheduled Caste Scheduled Tribes Amadi 2022 board exam gi meritorious students Singidamak free ship Tamjuri Amadi hostel di khudong chabasu pichiri hena ko pamorog gidamak Sega Road Konjing Hajari Laikai opposite Sangai Express leba aikoi office election biratuna khangbi yagani
Presto Personalized Wonders, Imphal da nauna hangdok chari, Haidiba asida personalized gifts, corporate gifts, awards and mementos, home decor, office rubber stamp na chingba potlam sing, mafam asida pangbigani, ngasi maglangsing birau, Tilak Ras Enterprises, Presto, Tangal Bazar near Kasturi Tong, Imphal. Contact number 0385-244-9025 natraga 98621-00456.
This program is brought to you by Presto, personalized wonders.
Breaking matungda amukahana taram nokchari ngasi akoina impact news ki impact health link da khana jarmi ba topic asi arthritis and treatment options habigi matangdani hiramasida Dr. CHETAN KABRA MBBS MS in orthopedic MCH ortho UK spine and joint replacement surgeon Apollo Hospitals Guwahati dagi expert oina linkshin biri. Doctor, after the break we would like to know what are the treatment options available for osteoarthritis.
Yeah. See, when it comes to treatment, the single most important factor which will make a huge difference is quadriceps strengthening exercises for the knee joint pain. For the back, definitely back strengthening exercises. See,
so these exercises can one perform at home or one has to hire a trainer?
Not necessary. You just need to learn from them for a day from the physiotherapist and you can do it yourself. See what happens when you sit for long duration in one position, your quadriceps they become weak. So ideally, we should all avoid prolonged sitting. Every 15-20 minutes you should get up, walk a little. So whatever little grease, whatever little synovial fluid which is inside the knee, can make a layer. This is the dryness of the knee which is actually like causing more of this thing, because the cartilage, the outer layer of the knee joint, the tibia or the femur, is supplied, gets its nutrition from the synovial fluid. So when the synovial fluid reduces with age, the cartilage becomes dry. So
is there no medicine to
no, there is
supply the fluid?
Yeah, we have few supplements but none of them is like 100% effective. None of them. Till date, we don't have anything which is 100% effective.
So what about those other supplements which is not found in the, there are many networking sites, many pharmaceutical company which
None
promises.
of them are 100% effective. None of them, definitely. What is effective is the knee strengthening exercise. This one exercise where you make the knee straight, keep it tight for 10 seconds, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, loosen it. This one exercise which you can do when you're sitting on a chair, when you're sitting on a sofa, when you're sitting on a dining table chair, wherever you're sitting in the office, you can do this one exercise. It can do immense good to you.
Okay.
Avoid sitting on the floor, avoid going to Indian toilet, use commode, don't sit, for doing puja also, for prayer also, don't sit on the floor, don't avoid cross-legged sitting. All these things will make a huge difference. Try to reduce your weight, try to maintain the weight. So knee strengthening exercise, especially for the knee pain, is single most important factor. Suppose you have done everything and still like the knee pain is very much persisting. Avoid painkillers as far as possible. Painkiller will reduce the pain, it will not cure the disease. You have taken supplements, you are doing knee strengthening exercises, pain is still persisting, you are applying hot water bag, you are applying ointment and everything, but the pain is still persisting. The pain is so much that you can't sleep at night, pain is so much you cannot walk, then you have to think about knee replacement. Knee replacement is the last option when it comes to surgery, when it comes to osteoarthritis treatment, but knee replacement is the best option, but is the last option. This is not the option which we do it on day one.
Okay.
When everything else is exhausted, we are not left with any other options left, that's when we start telling the patients about knee replacement. There are two kinds of knee replacement. One is a unicompartmental knee replacement where only one side of the condyle, they are like, we have the patella, we have the tibia of the femur. So if only the femoral tibial joint, that too on one side is involved, we talk about unicondylar knee. But when there is an involvement of the patellofemoral joint or the entire, the tibiofemoral joint, then we talk about total knee replacement. And the total knee replacement, why we don't talk about it in the initial part of the disease? Because it has a life. It will not last forever. It's a metallic joint with a, plastic kind of thing in between. We call it poly. So this knee replacement generally lasts for 20 years in 90% of the patients.
Okay.
So suppose if the patient is going to survive till 85-90 years, or say patient is going to survive till 80 years, so we cannot do this surgery as far as possible before the age of 60. In case of osteoarthritis, in case of rheumatoid arthritis, where the patient is completely crippled, almost bedridden, we do it much earlier. But in osteoarthritis, we try to do everything possible to avoid knee replacement in the initial part of the disease. When everything else is exhausted, patient is already above 60 years, then we start talking about knee replacement where the patient is unable to sleep at night. Pain is the single most important criteria to decide on the treatment at the end of the day.
So with uni replacement surgery, it can be done with any age group, or
uni replacement is, suppose if only one part of the joint is involved, it's a comparatively smaller surgery, smaller incision.
so
we do this
how
surgery.
is it, like durability of the,
Again, it will last for like maybe 8 years, 10 years, 12 years.
then
So
the
suppose
patient
if
has to
has to
redo
undergo
that.
another surgery. If suppose the patient is young, say 56, 54-year-old, 57-year-old, and only one joint is involved, why will you completely replace the knee? So you replace only partially. You do a unicondylar knee, lasts for 7 to 10 years, maybe 12 years. After that, the patient's pain like completely increases too much, and then you convert it into a total knee replacement.
So doctor, if a patient has undergone total knee replacement, so after like maybe 15-20 years, can he undergo again?
Yeah, definitely he can undergo again. We always have the option of like doing another surgery. But suppose you have done a knee replacement at the age of 65, and the patient needs another surgery at the age of 85, you have to think twice. Maybe
because of the
3 times.
age factor,
Yes,
blood pressure.
yes.
Okay.
Multiple blood pressure, diabetes, and all, like almost every patient has. We are not much bothered about it. If the cardiologist says yes, patient can be done, surgery can be done without much risk, we can definitely go. We have multiple investigations, by which we can decide with how fit the patient is for the surgery.
Okay, so
The
is it
best
a
part
major surgery to do a total knee replacement?
Yeah, it is definitely a major surgery.
So
it is
the
a major
patient
surgery.
has to be like fully.
No,
Okay.
no. The best part about
Semi-conscious.
this surgery is patient need not be completely unconscious. We just make the lower limb unconscious. Patient is awake during the surgery. Patient can hear everything, whatever we are talking to, like cesarean section. Patient can hear everything, whatever we are doing. Another best thing about this surgery is patient is walking from first day post surgery.
Okay, so how
Patient
long
can
does
start
the
going to the
process? How long does the surgery take, and then like after how many hours After 1 hour or 24 hours or?
The surgery per se will last like 1.5 hours. Within 1.5 hours, the surgery is completed. Generally,
and the patient can start working?
Patient can start walking from the very next day.
The next day, okay.
Yeah, the very next day, the patient can start walking. And some patients within 24 hours, they are willing to go to the toilet themselves. Some patients takes 48 hours to go to the toilet. So they can start doing their own activities.
So how, what will be their movement like? Will it be like the normal movement or?
After the surgery also, like I told, once the patient is diagnosed with osteoarthritis, we ask them not to sit on the floor, not to sit cross-legged. Similarly, post-surgery also, patient cannot sit on the floor, patient should not sit on the floor, patient cannot go to Indian toilet.
Okay.
So up to 90 degree is very normal, climbing stairs is still okay, but sitting on the floor is not recommended and patient may not get enough movement to bend the knees so much that he can sit on the floor.
So when you talk about durability, how would a patient know that his replaced knee is not working fine? Like, will he start getting pain?
Yeah.
That's
pain.
how he'll come to know?
Yes. Okay. Pain will be the important criteria. And definitely see, once you have undergone a surgery, it's an artificial knee. So what God has given is not there. What has been given to you is like what has been made by a man. So obviously you are supposed to keep it very nicely so that it lasts longer. The more better you keep it, the more it will last. The more you misuse it by, if you try to run, if you try to climb stairs very fast pace, definitely not last that long. But if you keep it nicely, it can easily last 15 to 20 years comfortably.
How about the sensation? Will the patient feel as if there is a foreign body inside his body?
No. There won't be any of this because the cartilage doesn't have a sensation.
No sensation.
Once the cartilage is removed and the bone is exposed, that's when the pain occurs in the knee. So osteoarthritis, what happens is the cartilage, the outer layer, the glistening layer, when it becomes dry and like it peels off and the bone is exposed, which has got the nerve fiber, that's when the patient has pain. So the sensation is almost the same as like the normal knee which we have. Yeah.
Okay. So what is the success rate of total knee replacement or even knee replacement?
I only told 90% of the patients will survive like 20 years.
Okay, that's a success rate.
So that's very good success rate actually.
And what about the cost? Is it very expensive?
In our hospital, we have a package where we do the knee replacement surgery for 1,50,000 rupees.
Okay, and in Imphal,
which includes the best implant, which we include, where we include the best possible implant available in India. Yeah, for 1,50,000 rupees, including everything. It's a package.
Okay. And but doctor, there is like even in older population, like even if they know that they are suffering from knee, they are scared of undergoing this knee replacement surgery. They feel that once they go, I don't know, they have some kind of apprehension, unwillingness. What would you tell them?
See, we Indians are blessed actually. We live in a joint family. We have our family to take care of us. We have servants, we have drivers, we have almost everybody, to take care of us. In a foreign country like UK, where I was working for a while, there, most of the people, the elderlies, they live alone. They have to do all their activities alone. They are always willing to get the knee replacement surgery done because their friends and already have done the surgery and they know how good the results are because they have to be independent. In India, because there is someone to take care of us, someone to go and buy the grocery, someone to go and take us to a temple, so we don't bother that much. But the results are fantastic, is all I can say. Results are very good.
So like it's better to get it done and live a very quality life.
Quality of life is important. We Indians, we believe in quantity, but we don't believe in quality. Quality of life is equally important. Why should you be dependent on anyone when you can be independent completely?
Right.
And what people don't understand is walking is important. With knee replacement, you can walk again. If you can walk again, your heart, kidney, liver will last longer.
Okay.
You will survive longer. Literally, you can increase your life by 5 years by getting a knee replacement indirectly because your heart, kidney, liver, will live longer.
People need to be aware of that as well.
Yeah, it's very important that they should be aware of it. Yes, it's important. People don't realize it.
Okay. Thank you, doctor. Now, as we have come to the end of the interview, what would you like to convey to our public?
Well, what I would like to convey is lifestyle modification is the key for we Indians in general. It's high time we realize that our nutrition in the diet should be much more higher than what we are having. We should reduce the oily food, we should reduce the sugar content in our diet, we should reduce the salt content in our diet so that our weight doesn't increase. We should inculcate the habit of making our children go for exercise every day in the morning. Manipur is blessed in that way because we have so many Olympians from here.
Yes.
But in general, if I have to say, definitely change of lifestyle will do immensely good in preventing or reducing osteoarthritis in the general population.
Thank you so much, Doctor. Doctor, this special program is sponsored by Presto Enterprises. It's a company based in Imphal. So we would like to present this to you as a token of appreciation. Thank you so much.
Thank you.
Thank you for your time.
Thank you. Thanks a lot. Thank you.
Nasigi episode asida akhina Dr. CHETAN KABRA ga hozik osteoarthritis adagi arthritis hariba laina sigi makhal mayam magi types kari lai bage habze akhina khangminare loinana akhigi karamba lifestyle healthy lifestyle adagi aphaba diet charaga exercise tawraga akhigi hoziki Kugi naba the arthritis joint pain myam je kamai ngak thokadagi haibi matang disu khangminare loinana doctor na thambibasi huji akoina khu je knee pain gi damakta khu je pura soire haiba targadi total knee replacement tawbasi masi last option ni masi option ju fazana laire haibagi wafum kya thambire mathangi episode ta topa topic ma pudun lakchege haraga myam dai kaina no ya thangni jari. Thank you.
Football Academy. Chaliba Chahi 2023-2024 gi oina Haryana gi Jinda laiba GPS Academy, a unit of Delhi Public School gi oina akhano player kara Manipur dagi launchagadauri. Lakiba March ki tang 13 malom da laiba Telakha ground amadi tang 13 NESU ground Porampat TV Tower da ayuki pung 3 gi hogna trial pangthok chagadauri. Under 13 amadi under 15 gi Manung Channel